Hi class, my name is Yala Baleno and today I will be presenting about ringworm, the identification, characteristics, and how to manage it. And here's a little meme to show how severe it is, especially in the vet world. Have you ever experienced something like this? Do you have symptoms of itchiness or scaly patches? What about blisters? Also, skin discoloration. And lastly, overlapping rings? Well, if so, roses are red, wine is the answer. I hope you have ringworm instead of skin cancer. All jokes aside, ringworm is caused by dermatophytes, and it is a fungal infection that affects the skin. Even though worm is in the name, there is no worms in this. These fungi thrive in warm and moist environments, such as a locker room. Unfortunately, everyone is susceptible to ringworm and it spreads easily through close contact. You can get it from contacting an infected person, animal, or object. You can even contact it indirectly through contaminated surfaces like towels, clothing, shoes, even floors. Which is why it's important to always wash and disinfect items and clothing. Pets are highly susceptible to ringworms as they touch everything and anything. And as a pet owner, I always love to kiss and hug my animals. Before doing so, observe your pet and make sure that they don't have any ringworm or symptoms of it. And to always get your vets checked yearly. The microscopic morphology of dermatophytes includes 1. Trichophyton, 2. Microsporum, and 3. Epidermophyton, and they appear as hyaline septate hyphae. The metabolic characteristics of this fungi are keratinophilic fungi, which means that they metabolize keratin, it's the protein that is found in skin, hair, and nails, which allows them to invade and thrive on these tissues, which causes characteristic skin lesions. In order to identify these, you can use a fungal culture on a selective or differential media, such as Saborad agar with antibiotics or dermatophyte test medium, aka DTM. There are several diseases that are caused by ringworm. The first is tinea corpus. It is a ringworm on the body that presents as red, scaly patches with raised borders. The second is tinea capitis, which is a scalped ringworm, which is ringworm on the scalp, which leads to hair loss, scaling, and sometimes inflamed nodules or pustules. The third is tinea pedis, which is commonly known as Ali's foot, and it causes itching, burning, and cracking of the skin between the toes. The fourth and final disease is also known as jock itch, which affects the groin area, causing redness, itching, and sometimes even blisters. But don't worry, ringworm is very easily diagnosable from clinical exams, skin scraping, and even cultures. Ringworm is fortunately easily treated by using antifungal medications like Lotrimmine or topical azoles or oral medications for severe infections. Here are a few tips for managing ringworm. Number 1. Keep affected areas clean and dry. 2. Don't wear clothes or footwear that causes you to sweat. Also, don't share clothes or footwear. 3. Change all of your clothes every day. 4. Don't cover ringworm with bandage or other dressing. 5. Throw away any disposable items that might have been infected. And 6. Wash hands thoroughly after touching an affected area. Prevention involves maintaining good hygiene, so avoid sharing personal items and wear protective footwear in communal areas such as the gym, the sauna, and even your own home, because you never know who can come in walking in with ringworm. But before I go, I would like to ask you 2 questions. Number 1, how might the rise of antimicrobial resistance impact the treatment of ringworm infection in the future? And my second question is, what public health rule could be implemented to reduce the transmission of ringworm in areas with high infection rates, such as the gym or community areas? I hope you learned something new today about ringworm and ways to not get it. I hope everyone is having a good last push of the semester, and good luck to everyone and in their careers.